Hi everyone, my name is Taviana Ubakar. I'm a fourth year medical student at Wake Forest School of Medicine, and I've been part of the Radiology Scholars Certificate Program for the past 4 years. I'm here to teach you a little bit about inherited renal diseases and some radiological findings associated with it. Some of our learning objectives are going to be to name some genetic renal diseases, understand the different ages that they present as well as be able to name some of the clinical findings that a patient may come in with, and what kind of imaging we can order for patients that we're concerned may have inherited kidney diseases and what we may see. So, what are some inherited renal diseases? These are just 4 of some very common renal diseases. The first one is a distal renal tubular acidosis, which is known as RTA type 1, tuberous sclerosis complex, autosomal dominant and autosomal recessive polycystic kidney disease. RTA type 1 can be acquired through various means, genetic mutations as well as autoimmune or medication use. You can have genetic loss of the luminal hydrogen ATPase of the intercalated cells, leading to a loss of hydrogen ion secretion, or bicarb transporters in the basolateral chloride bicarb exchange. This leads to a defect in distal hydrogen secretion and a urine pH that is basic or higher than 5.5. There aren't any specific imaging that you can order for RTA type 1, but it is associated with increased stone formation, and nephrolithiasis or kidney stones are associated with flank pain, blood in the urine, as well as pain with urination. Tuberous sclerosis complex is a mutation in either TSC1 or TSC2 genes that leads to an impaired production of hamartin or tuberin proteins, and this leads to skin lesions as well as tumors that are benign or malignant and seizures. It affects multiple organ systems. 80% of patients present with renal manifestations as well as 90% with cardiac manifestations and cutaneous findings.
This is an image of a patient with tuberous sclerosis complex, a CT abdomen pelvis with contrast in the axial view in image A and coronal view in image B. It shows a right partial nephrectomy and an enlarged left kidney with multiple angiomyolipomas, which are essentially fat attenuation masses that are seen growing from the lateral aspect of that left kidney. There are also multiple additional small angiomyolipomas and cysts bilaterally in both kidneys.
This is now an ultrasound image that shows both kidneys are enlarged with multiple cysts and loss of that normal kidney architecture that we would typically see when we do an ultrasound. Autosomal dominant polycystic kidney disease is another inherited renal disease. In 85% of cases, there's a mutation in PKD1 on chromosome 16, or a mutation in PKD2 in 15% of cases that occurs on chromosome 4. This usually occurs in adults, usually between the ages of 40 to 50-year-olds, and leads to numerous cysts, both in the cortex and medulla of the kidneys, that causes the kidneys to appear much larger than what they are, and it leads to destruction of the parenchyma of the kidneys because of how many cysts are taking up space and how enlarged that kidney has become. This is associated with Barry aneurysms, mitral valve prolapse, benign hepatic cysts, as well as diverticulosis. Some of the symptoms that patients may present with is flank pain that can be on one side or both sides, blood in the urine, hypertension due to that increased renin secretion, increased frequency of urinary infections, and this can ultimately lead to renal failure in more than 50% of patients and require dialysis and or transplantation down the line. Death can unfortunately occur secondary to complications of chronic kidney disease or uncontrolled hypertension. This is an ultrasound image of a patient with autosomal dominant polycystic kidney disease, and it's described as this characteristic grape appearance as a result of all the cysts that you can see in the kidneys. So if you see a grape-like formation, kind of think of or be on the lookout for ADPKD. Now we're looking at a coronal CT of the abdomen pelvis in a patient with ADPKD. And as you can see on this image, there is marked enlargement of both kidneys as well as multiple cysts that we're seeing in the liver. Like previously mentioned, ADPKD is associated with both renal primarily as well as liver cysts. So don't expect to only see it in the kidneys. Autosomal recessive polycystic kidney disease is similar to, but is seen early on during infancy in patients secondary to a mutation in PKHD1, which is responsible for producing a protein called fibrocystin that's usually involved in the structural integrity of the kidneys. This again leads to a cystic dilation of the collecting ducts instead of those multiple cysts that we're seeing within the medulla and cortex in ADPKD. This ARPKD is associated with hepatic fibrosis and can lead to oliguric renal failure in the fetus, which then leads to Potter syndrome. As you may recall, Potter syndrome is a result of too little amniotic fluid and leads to this characteristic flattened nose, prominent epicanthal folds, and low-set abnormal ears with some underdevelopment of the lungs if there's severe oligohydramnios present. Other consequences of ARPKD is hypertension, renal insufficiency, and portal hypertension. This is a series of ultrasound findings of a patient with ARPKD done of babies and young children, which again shows dilation of the collecting ducts. This is an image of a newborn baby with hypoplastic or underdeveloped lungs in the case of severe oligohydramnios as seen in Potter syndrome. Thank you so much for tuning in and learning with me about 4 inherited renal diseases, some image findings associated with it, and what symptoms to see in a patient. I hope that this has been informative and that you walk away feeling a little bit more confident in what those 4 diseases are, or at least can recognize that as having renal manifestations the next time you hear those names. Thank you and enjoy the rest of your day.